debate in Congress in terms of finding the votes, getting the political mandate together for making this happen. Tell us any stories you can tell us.
Let me put it in a little different perspective and then go to that. When the president was elected, he had an agenda that was in his budget. This was a blueprint for economic stabilization going into the future. It was about a statement of our national values as to what is important to us as a country, as to how we would allocate our resources. We hadn't had a budget passed the Congress on that made that standard in years and years. And now we had a new president and the bill passed the House and the Senate. And it was about lowering taxes for the middle class. It was about reducing the deficit. It was about growing the economy and creating jobs around three pillars. Healthcare for all Americans, first among equals, education and innovation, and third, energy and climate change to take us into new clean energy technologies. These three pillars were to be the job creators and also the deficit reducers, because they were, if nothing reduces the deficit brings more money to the Treasury than investments in education. So as we went forward in the House, we passed the budget and we passed the three bills: energy, climate change, education, and then health care. When we went to our budget, we did not include the climate change because that had not moved in the Senate. So we had health care and education. So this legislation is about two very important pillars of our society, of our economy, and of the president's agenda: education and health care. And so as we went forward, that people were saying, what does education have to do with health care? No, it's a budget bill. This was a budget reconciliation bill, and it had to do with both of those. I want to say more on the education piece in a moment, because it's very, very important for Americans aspiring to higher education who need Pell Grants and the rest, but also to make it more affordable for the middle class. As we went forward with the legislation, many of us were supportive of a public option that we wanted to have in the legislation, but not wedded to that particular phrase. We were wedded to what a public option would do: to hold the insurance companies accountable, to make competition, to improve competition, help the consumer, lower cost, improve quality, and again, increase access. And so it's always hard. There's no easy thing in Congress when you're trying to make this kind of change, but everybody was excited about the prospect of freeing the American people from this anvil of the cost of health care. Whether it was an individual or a family, whether it was a small business, whether it was a big business, which was footing the bill for a lot of people, even people who weren't their employees, or whether it was just the cost of our economy. It affected the competitiveness of America, that we in our country had our businesses weighted down with the cost of health care when their competitors in other countries did not. And so we were pretty confident about the course we were on. We had a little different view than what the Senate had. They did not want a public option. In other words, as long as the goals were achieved, it didn't have to be by any particular terminology or entity. When the Massachusetts election took place, people thought, oh, that's the end of health care. We also saw it as an opportunity. We just saw it as an opportunity. Now we'll go with 51 votes. We're sure we'll get that, and we will do what we set out to do. I never had a doubt that we would pass it, so it's hard for me to answer this most frequently asked question. I never had a doubt that it would be passed. I had confidence that my members, that our colleagues had this as a value, understood the difference it would make in people's lives. And unfortunately, we were in this, we had hoped, and the President had hoped, that there could be bipartisan support. But the main difference was what do you want to do about the insurance companies? If you want to regulate the insurance companies, we can find our common ground. If you don't, we have to leave without you, unfortunately. I might say, 1 year ago in March, the President called a summit. Democrats, Republicans, House, Senate, every stakeholder, insurance companies, pharmaceutical, children's health people, the community, health centers, the rest came, and everybody was hoping that there could be a bipartisan legislation. But as I said, the separation came when what are you going to do about the insurance companies? Because if you're not going to that place, you're losing the opportunity for the American people, and I'll tell you why if you ask later. The President really tried, but we thought this bill would be finished by early fall, but the President kept giving more time to get more bipartisan support. To the point of February 25th, we had another. One was March 5th, I think, of last year. Almost 1 year later, February 25th, the President called another bipartisan meeting, House and Senate, Democrats and Republicans, to come together to hear what additional ideas Republicans might have that we could incorporate in the bill. It was, I think, at that time that the President realized that they were not going to do anything about the insurance companies, that he then just went forward. And I think you saw a difference in the last 6 weeks or something, 4 weeks before the bill. But he went forward and said, this is the bill, this is where we're going. We wanted bipartisan support, but if we don't have it, it doesn't mean we're not going to have a bill.